Welcome to the Dental Handoff. I'm Dr. Kelly Tanner, and today I have with me Lauren Rainey. Lauren, thank you so much for being on today.
I am thrilled to be here. Thanks for having me, Kelly.
Yeah, we met in passing at an event. It was like, hey, we need to connect. Yeah. And here we are. You've had quite a journey, and I was listening to you before the show and about all the things that you've been able to do in your career. And I'm excited for you to share some of the things that have brought you to where you are today. So the question I always start with is, why dentistry? Did you choose it? Did it choose you?
Ooh. Well, I think it's maybe a little bit of both, but it was a career that I was told would give me the opportunity to have it all. I was naturally drawn to the medical professions. I come from a family that has a number of nurses and a handful of medical doctors, and it seemed like that's where I kind of was headed, just because I loved science and I loved being able to be like a helper. But when I realized that there was a connection between the science and the art and the potential for small business ownership and, this unicorn of balance, that seemed like a good fit for me. I was also not really interested in being in school until I was in my mid-40s, which some of my medical doctor colleagues felt like they were. So dentistry seemed like a great fit. My grandpa was actually a root canal specialist, so he was an endodontist and was in education. He went the military route, but he really encouraged me to give it a good think. And so after college, I spent some time living abroad and knew that I wanted to kind of get that out of my system. I was teaching English in Japan on the southern kind of island there.
Oh, wow.
Which was not where most dentists headed to dental school find themselves. But got that kind of adventure out of my system and was like, yeah, I still think I want to go, professional healthcare path, and applied to dental school from Japan. Came back and interviewed, and luckily that worked out for me.
And then where did you end up going to school?
I went to University of the Pacific in San Francisco, and that was just incredible opportunity, not only because of its 3-year program, but I was looking for something with a very clinical perspective. I knew I wasn't interested in research. I'd done a couple of research projects where I went to college. Luckily, I went to a small liberal arts school that allowed for undergrads to be part of their science and research programs. We didn't have grad students, so all the students doing the research were undergrads. But after spending many hours in the lab drawing, Sharpie on a mouse tail, I realized that was not really where my passions lied. So I wanted a clinical program. And so I was looking at schools like Tufts, Case, and Pacific. Mm-hmm. And Pacific was a great fit for me. I feel very lucky to have gotten a spot there. And I'm still pretty active with their alumni association there.
Oh, that's awesome.
Yeah.
So you graduated, and then what came next for you?
After graduation, I ended up back on the East Coast. I did a GPR at Tufts, and that was another experience that I wasn't really sure that I was going to be the right fit, but ended up being exactly where I needed to be. There was 4 of us that were residents. We did a ton of OR cases, and so that put us in the OR, once a month for an entire week. And in dental school, I'd kind of dabbled with whether I wanted to go into peds or stay a general provider. And part of what attracted me to peds was actually like special needs. And so when I did the GPR program, we were seeing a lot of patients with complex medical needs in the OR. And I realized as a general dentist that is what I really loved doing, was seeing people where the puzzle pieces kind of all fit together. And you had to really think about like big picture stuff, but also care for people over the course of their lifetime. And then even though my grandfather was an endodontist and he loved that, he didn't track the patients for a long time. And that's what I was looking for sort of in a career, was to have those kind of long-term relationships. So I ended up out in Massachusetts. I was there for a couple of years. And then there was a job opportunity for my partner to come back to the Bay Area. So we ended up in the Bay for the next 10 plus years and moved up to Seattle about a year ago.
Okay. And then are you doing it all? You're doing all the things. You're lecturing. You're doing, every day we learn. Yeah. Right? It's not about being perfect. No. And in our minds, I think that we're such okay, we have it in our mind a lot of times what we want it to look like, which is our ideal. And then sometimes it turns out like that or better. But through that process of feeling like this is not working, it's such an uncomfortable phase. Would you agree?
Oh, for sure. I think coming to that realization of it's not working is really difficult, especially for someone like myself that has, 3, 5, 10-year like written out like plans for my life. When things do not go according to plan, it's like, oh, hold up, that was not what I was hoping for. But I've worked with I have actually 2 or 3 executive coaches and leadership coaches, and they have steered me, helped steer me in a direction that felt true to myself. And that was a really difficult thing to learn. But
so what was, since we're on that topic, with the guidance and support you received, how do you feel like that helped shape you and some of the decisions? I mean, we were talking about before managing our own expectations of ourselves, of what we think is going to get done today and what actually gets done today.
What are some of the things that they helped shape?
Yeah, like what are some of the things that their advice helped shape within you?
So one of the tools that one of the coaches I worked with, his name is Mike, was using sort of like dials and figuring out like, does this fill you emotionally? Does this fill you financially? Does that like, I kind of like rate in a couple of different ways, like out of 10, does this feel like good to you? If it's only like a 3 out of 10, then like, why would you say yes to that opportunity? And so when it's come to some more challenging decisions, I kind of think about, okay, if I've got my dials here, and I can't recall like right offhand like what those 4 are, but I kind of look it up. And I also just like know within myself if it doesn't feel like, I'm much more in tune now with like, does that feel right? And one of the other coaches I've worked with is like, her term was like, does this serve you?
Yes.
If it doesn't, then like, do you still want to do it? You can always say yes, knowing that it may not, fill your cup, but it's also okay to fill your cup first.
Absolutely.
And I think that is really difficult to actually do. It's very easy to say, but in real life and real practice, that is very difficult to do. So they have both helped me immensely in recognizing that that's okay. I mean, having a support network of like human people, like my family and my colleagues and friends that also like encourage me to do what's right for me, not what's right for society, not what's right for the dental profession, but like what is right for me as a human being.
Yeah, it's always nice to have that sounding board to help you identify those blind spots. I was just talking about that the other day when it came to, I was talking to my partner about, have you ever dated someone that you look back and you're just like, why did I ever date them? Or whatever that is, or why did I ever think that was a good idea? And the people around
why was I
you,
friends with that person? And why did I think that their opinion mattered like so much? Like,
yeah, but then the people around us sometimes are going, I knew that wasn't going to work out. I knew that they weren't for you. And I'm like, why didn't you tell me? We all have blind spots. This is important. Well, you were happy. You're happy. And it's like, okay, but you are seeing what I'm not. So it's important to do that. And that support network is, I think, exactly that.
But it takes time to find that and to build that up around you. And I've been very fortunate to find some great people within the dental community space at this point. I mean, when you're a new dentist or a new grad or a new provider, like you don't know up from down. But I've kind of along my way have found the people that, have shepherded me in the right direction. And for that, I'm really grateful.
Yeah. And so I know that you have leaned into a few different things, women's empowerment and networking. You're speaking now with Catapult Education. Let's hear more about what you speak on.
So most of what I speak on is on direct restoratives, and that ranges from tissue management to just prep design, all the way up to, how do we preserve after we've started a case? How do we hold that for whatever's coming next? But I also speak a little bit about making a transition to make a practice that serves you. And that for me the reality of that was turning a practice from a PPO model to a fee-for-service model, because that is what was absolutely necessary for the business to be successful, for me to serve my patients.
And I think that's a reality for many dentists now, where everyone's turning that. There's a couple different ways. I know that we can go with this. I want to know everything, but what is your strategy? Like, if you had something that you would say, like, what's your number one strategy to make that transition for docs?
The biggest piece of advice that I can give at this point, after I've talked to a number of doctors and practices that are considering it, and I don't do this formally, I just have a number of people that have called and asked, like, how do we do this? I think it really comes back to core values. And there was an exercise I did last year with a group actually called Dentist Advisors. They're a financial group, but they did a presentation for the group of people that were part of that Guiding Leaders program at Glidewell. And we can go there later if you want. But they came and gave a presentation, and they gave us these cards, and they looked like, playing cards, and they had words on them. And they said, okay, well, here are the words. Here's like 50 words. What are like 10 that speak to you? And then we had to narrow it down and narrow it down and narrow it down. And they said, okay, those are your core values. Like, you as a person, take those and like apply those to your life. And that was just mind blowing for me to see it in front of me, like tangible cards of the 5 things that drive me as a human being.
Yeah.
Which then, because I'm just human, right? Those were the kinds of values that I was bringing to the patient care that I was providing. But those are also the values that I'm taking home to my family at the end of the day. Those are also the things that when we go on vacation, or how we want to spend our money as a family, or how we want to spend our free time, it still comes kind of down to those values. So I think really understanding as a core, like, what is valuable to you can help drive your practice. And for me, once I had those values in place, well, I didn't know I had these values in place at the time, but that's what ended up kind of like driving my desire to provide a place for care where I could choose the kind of materials I wanted to use, to give myself enough time to do it, to hire the people that were passionate and were going to do the best job. And for me, I couldn't do all of that in a PPO environment in California.
Yeah, that is it. When you said core values, that's exactly what I teach about all the time.
Okay. So there we go.
No, it's exactly. I was like, are we linked or something? And core values drive every single thing that you do in the practice. Yeah. Well, everything from a person. So when I teach leadership courses and go to dental practices, it's like, do you know your core values of the practice, but do you know them as an individual? And there's different sets of core values of, once you sit down, you have to compare them. Like, is one of your core values love, or is it security? Or because there's different exercises you can use. Sure. When you're taking them and you're saying, what are the top 3? That's hard. To say, I care about all of these things, but what do I care about more? What are my top 3? Because you have to say what you also don't think that you care about as much.
Right.
That's such a weird, cool thing. But as an individual, I think it's important to know what drives us, because then we attract who we are. And it makes it more intentional.
Yeah. I had not thought about choosing the 3 as unchoosing the other, like, 47 cards. But I think that kind of comes back to that coaching thing, right? Like, I had to be okay with what I felt for me, not what the practice expected of me, not what my colleagues expected of me, not what my parents expected of me, but like what I felt like in here.
Yes.
And I don't think we give enough value to that.
And I talk about that. That's self-love. It's ego over heart, right? It's ego of what we think that we want and what our head drives, which a lot of times cannot put us in the best situation. It's our intuition and our heart that we know in our gut of like, that's not a good idea.
Right. And that then drives, what your ethics and your morals are, right? Which is then in turn is going to reflect on how you treat a team member and how you treat a patient and how you treat a lab person that you work with. So,
and
I am thrilled that you are out there doing that.
Oh,
Generally what you were kind of speaking about, but that's very enlightening and heartening. So thank you.
Yeah. Well, oh my gosh. Well, it takes all of us, but if we know what we're about, like We know what we are and aren't about, and it's easier to define the things around us.
Yeah.
And also, too, I encourage for the practices, and I teach this, but for the practices to utilize their core values to hire, to evaluate their team, and to understand the usness of how the we is actually operationalizing every day. Because if you think about it, a lot of the practices, if you're a doc and you are not jiving with the core values of this practice because it wasn't what you thought it was, let's just say, people can tell.
Oh, for
right?
sure.
People can totally tell that that's not your jam. And you're going to act different. You're going to kind of detach from certain things. And it's going to be sort of measurable where when you go to get your evaluation, people are going to say, it seems like that you're not here, because they're using their core values of what you were hired under to drive some of this accountability to self and to practice.
Yeah.
And then it's an enlightening, it's a enlightening time. It's a time where the practice can be empowering, I think, to that individual to say, hey, how can we support you in this area?
Sure.
If you're feeling like if you are truly feeling this way, how can we do better to elevate the usness of the practice?
Yeah, I mean, it's like square peg, circle, hole. Like, how do we do, like, how do we not do this in every decision?
Yeah. And then you realize that in some instances, you just straight up don't align. And then that's
okay too.
Yeah. It always is okay.
Yeah.
And so in those instances where it's like, is this me? Yes, no, yes, no. Then you have those top three things of, does this serve me? Does it not? And is this right for me? Is this an area that I need to grow in? Because that's also an opportunity as well of, you realize these areas where you've been closed off are things that you're passionate about. I can go on about this. And I'm so glad that you have done that coaching, because coaching, when those things come in to identify some of the things you hadn't thought of and give you the aha, they affect everything in your life.
Yes. And I feel sad that it took me 35 plus years to get to that point. I am so grateful that I, by happenstance, ended up doing executive coaching. But I pretty much tell anybody that I know, I'm like, hey, have you ever considered that? I got a great person. I got some great people. You should just give them a call and consider it, because I just feel more whole as a human.
Yeah. And in this life, some people never learn it. Some people never get to learn that. And so I don't think at 35, when you learn that, or whatever age, maybe we're all still learning it.
Yes.
And I think how a lot of us learn it is learning by what we come up against, and it provokes a response of,
exactly. You have to have that precipitating event.
Yes. But that's what gives us the contrast of what we love and what we don't love. And I think that's what life lends itself to, is that contrast. And to say, no, not so much this, but this.
Yeah, I'm just grateful that I had the clarity when I got to those points, that it was like, okay, the universe has now taken a thunderbolt and struck me on the head 6 times. Maybe it's time to listen or pivot, or something about this is not quite right, because you go to high school, and then you go to college, and then you get the internship, and then you go to dental school, and then you do the residency, and you're just gunning for the next thing. Yes. Yeah. And even though if it's like this, I've got some grit. I inherited a lot of stubbornness from my parents, so I'm just ready to put my head down and just go for it. But you don't have to. And I didn't realize I didn't have to just fight so hard at every step of the way.
Yeah. You get to choose yourself all along the way too. And it's the easier way, I think, to choose yourself.
Once I made the mindset shift, yes.
Yeah. So with the PPO, I know that's a big, thank you for that advice, because that is central to everything. It's the self.
Yeah.
It's getting the self aligned with what it is and what you don't want. And so with that, I know that many offices are dropping certain insurances. Patients are upset. Conversations have to happen. So what do you think the patients are doing when the offices are like, we're no longer accepting your insurance. And it's a large patient base with that insurance.
Yeah. Well, the practice that I bought in 2016 was about 60% insurance driven. And so I know those people personally. And when it came time, like I was shown a very big number at the end of 2018 by my CPA. That dollar figure was $275,534. Like that was the dollar figure that I was not ever going to see from the 1 year of like write-offs by participating with the insurance company. When I saw that dollar figure, that was like really a kind of a scary moment for me. But then I had to like take that scary moment and then communicate that to our patients and say like, look, for our doors to remain open, we need to make some changes here. And here's kind of what we're thinking about. And I was actually talking to a patient about it. She had just recently retired and had been affiliated with the university system that was just a mile up the road. And she was telling me like, well, I'm paying my insurance company like $135 a month. She was like, and you're saying that my cleaning only costs like $135. And so she and I put our heads together. So I actually came up with this like membership plan with a patient. Two of us put our heads together and said, okay, what's going to work for you and what's going to work for me? And how do we continue to have a working relationship that can meet the needs of everybody? And so I put together what I thought was reasonable to run the business. And I just called her and we like met a couple of times and she was like, yeah, I'd pay you that. And I said, okay. So we opened it up to 30 patients. We filled those 30 spots like very quickly, just as kind of a trial run. And then it kind of just took off from there. And she told, her partner was already in the practice, their neighbors were already in the practice, and then the friends across the street. And it was just, she was able to advocate on my behalf and just say, hey, there was an issue and we troubleshooted.
Troubleshot. Yeah, you came to a solution.
We came to a solution together. And then our communication to the rest of the patients was just that. It was just like, here is the story. Here is the issue. Here is the solution we've come up with. Here's what we can offer at this point in time. And I had to recognize that for some people that served them and for some people it didn't.
Yeah.
And some people left and then they came back.
Yeah.
And I also at the time recognized that I couldn't be the practice for everybody. I couldn't be the employer for everybody. That the people that wanted to, get on the bus, stayed on the bus. And the people that didn't want to took a different bus.
Yep. Go find your bus.
Yeah.
And that's, I wonder, because so much of our public doesn't understand dental insurance and that it doesn't cover or what it does cover. And that I'll say this gently that, it for the most part, it covers health, right? It just like our medical insurance, prevention, it covers the majority of preventive care, majority. But when it comes
to the state and yes.
Yeah. But when you look at it like to what it does and what it doesn't, and they're not getting 100% of their money, like if you total your car. And so I think that the patients need to be better educated about what dental insurance is and isn't, just like eye care insurance.
Exactly. Right.
So how do you think we do that, Lauren?
Just by saying that. If you fall down the stairs, and I've said this, I don't know how many times, if you fall down the stairs of this office and you break your arm and you twist your ankle, the ambulance will come and they will fix your arm and they will fix your ankle and your medical insurance will cover hopefully a majority portion of that. They will take care of you as a whole person. If you fall down the stairs and you break your arm and you twist your ankle and you bust off 4 teeth, your dental insurance will say, we can do one part of one tooth this year. We can do the second half of that first tooth the second year. The third year we can do the second tooth. And it's just not comprehensive in the way that a lot of medical coverage is covered. And when I've had an opportunity and I do this conversation face to face with lots of patients, and I just say like, that is the reality of it. It is just not designed the same way that insurance as we know it in the medical side is. And yes, I also bring up the vision part because I wear contact lenses And they said, oh, well, do you want a contact exam? I was like, well, yes. You either get a glasses exam or a contact exam. So, well, I need both.
I want both. Yeah.
Right. So I pay for,
same.
yes, exactly. But again, I was a patient in the vision practice last week, and they just said, here's what you have, here's what you need. It's your choice. And I think it's hard for us as dentists to say that out loud. And if you don't want to be comfortable saying it, just find someone on your team that will. It doesn't have to be
that's
you.
Great advice.
And I think as dentists, we want to wear or feel the need for whatever reason to wear all the hats, and you don't have to. If it's not your jam, don't be that square peg, right? Find someone that loves having the insurance conversation, or find someone that is not uncomfortable talking about money, or find someone that is just super excited to, have the chit chat conversations if that's not your passion project as a provider.
Yeah. And I think as an individual, as a human, so taking that kind of pausing about the human element aside, if I know that I'm uncomfortable talking about it, an uncomfortable conversation is really a lot of times we are uncomfortable with making someone else uncomfortable.
Yes.
In dentistry. And why is that? Because it's in that comfortable time that people get to realize their own beliefs about something and if they're still true, but with information, people can understand, you can create understanding with that. So I think
you're open to it, right?
If you're open to it, yes.
But you don't need to, again, hammer the point home.
Yeah. And it's at the end of the day too, it's about autonomy, giving the patient the information, letting them make the decision.
Sure.
And you had to make the best decision for your practice, and because it affects everything. It affects everything.
Yeah. Everything. I would not have continued relationship with that lab. I would have not had the opportunity to use, top quality materials. I would have not been able to have the best talent, right? All of it. I would either have to keep the lights on or pay the front office. We could do this in the dark
or not use a higher quality material, go for the one that's X amount dollar less, that doesn't perform exactly like the one that I prefer. Yeah.
And so it's just all about choices and being okay with not judging myself about those choices, and also not judging anybody else for those choices, because again, it comes down to what my values are not going to be the same as yours, and are not going to be the same as the person next door. And I'm okay with that.
Yeah. And there's only one you, and
True.
And you bring what you bring to us. More. Why not? We could rule the world.
I love the way you think.
Yeah. Anyway, but I get it, but we have to I think to know the numbers and to see it, how you did was so impactful, to say, okay, I've got to do something. This didn't feel well. So I think that the timing of your journey was a synchronicity. It was a divine appointment for you to say that it all came together how it should.
Yeah. I didn't feel good, but that was my sort of precipitating event that helped me see, okay, this is not working. How do I create the business, the life that I want?
Yeah. All the things, all the dials.
All those.
Yeah. Well, any final words that you would like to offer our audience on advice or anything that you might want to say?
Gosh, I feel like we covered a lot of ground here, and I was not expecting to go sort of all of those directions. But if you're thinking about making a big change from that PPO model to a fee-for-service practice, there are a lot of resources available. When I did that in 2018, there weren't. Now there are podcasts, there are webinars, there are articles. There's an article that came out in Dental Economics just this month that kind of talked about that. So, start opening those things and looking at them and figuring out if that might speak to you. And if you know someone else that did it, or you want to talk to someone that has, you can get in touch. I'm happy to chat at any point in time.
Yeah, cool. Lauren, thank you so much for sharing your expertise for our listeners and watchers and followers. her contact information is in the show notes. And it's been a pleasure spending time with you, Lauren. Thank you.
Oh, you're so Kelly. It was nice to finally face-to-face. Well, as face-to-face as we could get right now.
Yeah. We'll see each other soon, though, I'm sure.
I know it.
And for all of our listeners, if you wouldn't mind, like I always ask, go on over to Apple Podcasts, give a 5-star rating, please, because Apple's the one that matters with the ratings. And then go on over to YouTube, like, subscribe, share, press that like button so you can be notified and others can be notified around you of when a new article, not a new article, but a new podcast. Yeah, I was thinking about articles in dental economics is posted. Thank you for everything that you do, everyone. Keep making a difference, keep touching lives, and we will see you next time. Thank you.